Thank you again for the introduction. I'm very glad to be here today. And thank you to IOMP and LAP for inviting me to share our clinical experience with Luna 3D, the new SGRT system from LAP with you today in this webinar. So this is my disclosure. We are actually one of the first clinical installation sites of Luna 3D. And since the first installation, we have been working closely with LRP in testing and in evaluating the clinical workflow with Luna 3D. Before I start my presentation, I would briefly like to introduce our institution. So the Clinic for Radiation Therapy and the University Clinic for Medical Radiation and Physics at the Pius-Hospital is part of the University Hospital in Oldenburg. So we engage in clinical as well as teaching and research activities. Clinically, we operate 3 Elekta linear accelerators, 1 Synergy and 2 Harmony Pros. Our institute has actually maintained close partnership with many industry partners, and actually we are very happy to be the first clinical installation site of the Luna 3D system. So in the past year, actually, Surface Guided Radiation Therapy, or SGRT, has evolved into as a standard of care in modern radiation therapy. And Luna 3D from FIP is a new player in the field of SGRT. But first of all, why do we need SGRT? Among others, SGRT could offer high precision and efficient patient positioning without applying additional dose to the patient. It also enables dose-free patient monitoring, allowing advanced online motion management, for example, DIBH. It can also provide higher patient comfort by eliminating the need for markers or tattoos on the patient. And one also has then the possibility to reduce uncomfortable patient fixation, for example, masks. So SGRT is actually more than replacement for lasers. In contrast, I think this system can do much more actually in the coming years. So why Luna 3D? After using Luna for some time, we think that Luna offers some unique features that I want to emphasize here. So first of all, Luna 3D is very easy. I know that many clinics have concern of the learning curve in introducing a new SGRT system. And I think it is true that implementation of SGRT system in the clinic requires tremendous team effort. And more importantly, also the willingness to embrace the new technology, especially when we know that the lasers have been used for a long time. But I think the simplicity and more importantly, the very intuitive browser-based interface of Luna 3D could really help to overcome these challenges at the beginning. The system is also very fast using GPU parallel computing that guarantees very high performance with very large field of view and very high frame rate. And lastly, one of the features that actually we like the most is the virtual lasers, as shown here on the right-hand side. And this feature is really cool, and I will explain a bit later why this is the case. So currently we have 3 Luna 3D systems installed in our hospital. So the first installation was actually already in June 2023 at an Elekta Synergy accelerator. We have also now the Luna installed with 1 pot at our new CT last year. And we have also 1 new installation plan in the coming weeks. So since the beginning of our journey with Luna 3D, our RTT team has been involved in the clinical evaluations and implementations of the system. So we had some useful on-site trainings here with Wolfgang. to give our RTT first-hand on practice with the Luna 3D system. We also had actually a great and very fun training at the headquarters of LYP in Oldenburg some time ago with the whole team of RTT. As you can see here, it was really very nice, very fruitful training for everyone. So from the physics perspective, of course, we also need to ensure that the accuracy as well as the reliability of the Luna 3D system before we proceed with the complete clinical implementations. So we have been performing actually a lot of testing and measurements with the Luna 3D system since the first installation in 2023. And some of these tests were performed based on the recommendations in the ESTRO guidelines on SGRT systems, including static accuracy, dynamic accuracy, as well as a very comprehensive end-to-end testing. In the next slide, I will present to you some of these results we got. So firstly, the static accuracy test. So this is actually a very simple test, but also important. So we actually use just our daily check routine with the PentaGuide Phantom. So what we did was we first aligned the Phantom to the room lasers. So as on the left, and then on the right, you could see already the agreement between the Luna 3D measurements as compared to the external structure derived from the CT scan of the Phantom. So after the alignment, so on here you could see this offsets value, the 60 offsets values. And take note that these values are all given in millimeters. So all these are actually well below 1 millimeter. And to test the translational and rotational accuracy of Luna 3D, we use the Ruby Phantom. We have heard about this Phantom in the previous presentation from Daniela. So what we did was, we first positioned the Ruby Phantom correctly. So as shown here on the left side or upper left picture. And then we capture a reference of this position. And then we could reposition the Phantom with a predefined translational and rotational arrows, as shown here in the lower left figure. And then we could compare the measured values, the 60 values from Luna 3D to the expected values. And you could see the differences between these two, smaller than 0.54 millimeter and 0.1 degree. So actually very good results as well. And then we also did a lot of dynamic tests. So this is one of the dynamic tests we conducted using the CS dynamic lung platform and with the EZ-Cube from LYP. We have tried different motion patterns, different amplitude, different frequency. Shown here is one of the extreme cases where the EZ-Cube, as you could see here, was moved like up and down with 1 centimeter amplitude and 1 second per cycle, so 1 hertz. So it's actually a very fast movement. And here below, you could see the real-time recorded movement with Luna 3D. And here above, you see a zoom in of this registered spatial and temporal movement registered by Luna, which I would say hardly distinguishable from the actual movement of the Phantom. So the dynamic performance of the Luna is also actually excellent. And one of the most comprehensive tests we did was the end-to-end testing as recommended also in the ESTRO guideline. So shown here is actually our current end-to-end workflow. So we start with the CT, and then the data will be imported to the treatment planning system where the treatment planning is performed, involving registration, isocenter placement, optimization, dose calculation, and so on. So once this plan is ready, so it will be exported to our record and verify system prepared for the irradiations. And at the linear accelerator, the Phantom will be positioned with the help of cone beam CT. And after the necessary couch correction, so the plan will be delivered and we measure the dose and compare the dose to the expected value calculated by the treatment planning system. So we have to actually adapt this workflow to incorporate the positioning workflow using Luna 3D, as shown here in red. So the red are the additional steps we built in. So the main difference of this SGRT end-to-end testing workflow from our current one is that the positioning is completely performed using Luna 3D without lasers. So the room lasers will not switch on during the entire process. So in other words, we are not using any markers to position the phantom. So we use also the Ruby phantom for this end-to-end testing, as we have been using for our current testing as well. So because we are not using any markers on the phantom, we are not positioning the phantom using any lasers. So we could set our isocenter at any point within the phantom. So we just put it here as shown in the arrow, by the arrow. And then we prepare the plan and then export the plan and prepare it in the Luna 3D software. And at the linac, then we just align the phantom with the help of Luna 3D. So not using any lasers. So we align the phantom so that we have almost perfect values here as shown by Luna. And then after that, we perform a CBCT of the phantom. And the results are shown here. So I think we can agree that the results are very acceptable, well within the tolerance level recommended in the ESTRO guideline. I also want to note that this is an end-to-end testing. So the results here do not only show, let's say, the accuracy of the Luna 3D, but it reflects actually the total uncertainty of the entire workflow up to this point, including the planning, CT, the laser, and the KV isocenter or the CBCT isocenter congruence, and also the registration itself. So we still have actually very small errors here. So after that, of course, the last step was to irradiate the plan and to measure the dose. And in this case, we had, as you could see, agreement of 1.2%, which is also very good. So in the next few slides, I want to show you some clinical workflows with Luna 3D. The first step is the patient preparation. So it starts with the export of the DICOM data from the TPS. So the RT plan and the RT structure from the TPS, and then import this data into the Luna 3D software. So all the demographics will be imported automatically. And then the imported RT plan and the this external structure will be assigned to a treatment cause, for example, breast right or prostate or whatever we are going to irradiate for that particular patients. And after that, one would need to draw a ROI, so the region of interest. You could see here how it could be done. You can see the reference surface imported. And then what you could do is just draw the reference at ROI. ROI is used for the registration, so it means that the system monitor this region defined by the ROI. So in this case, a breast right irradiation, so we just kind of define the ROI in this way. So you could see it's very easy. And after that, if necessary, you could still edit some treatment steps. But normally you do not have to do that. Everything's done automatically. So with a bit of practice, this can be done within 1 or maximum 2 minutes by our RTT. And then after the preparation, then we can actually start using Luna to position our patient. And I think this is also the best place now for me to showcase the visual lasers concept that I mentioned at the very beginning. I will actually show you a recording of a real patient positioning. And let me pause for a second and let me start again. Let me pause for a second and let me try to explain what we are seeing. Oh, I'm not sure why is it jumping. Sorry for that. Okay, as you could see, there's a purple surface, and this is the reference surface of the patient, and the green surface is the real-time Luna 3D measurements. But what we really need to focus now here in this case is on the red and blue lines that are projected on these surfaces. So the red lines, they are the room lasers. So you can see them as room lasers indicating the isocenter of the room. So they are not moving, they are stationary. And then these blue lines, they are like markers on the patient. So they move along with the patient. So what our RTT needs to do actually is to just match the blue lines to the red lines. So we could see that this patient has a slightly rotation, like your rotations, and our RTT can actually easily identify this rotation and correct this. And you also see actually how sensitive and how fast the system is responding to what our RTT is doing. So the RTT is moving, correcting the rotations. And so working with these virtual lasers actually mimic the workflow of traditional lasers, but without the need for us to mark the patient, to do any to do any markings on the patient or tattoos on the patient. And our RTT really loves these features, so they use this actually every day or for every patient. And you could also see how fast our RTT could position the patient. Everything in this video is less than 1 minute. I think it's like 40 seconds. So this is the positioning of the patient. And I'll let you watch this video one more time, so without me explaining. So it's done. So that's positioning. So you see the lines match, and you have here on the left actually very good 60 offset values. And this is another example. So as seen earlier, once these two sets of lines, they match each other, the lines will turn into white, indicating that we have actually a good positioning. And of course, then during the irradiation, Luna 3D also monitors the patient for us. So this is another example. This is a prostate case. And you could see also here the virtual lasers, and you could see the real-time 6D values. And in addition, you can also see below here, like the log of the real-time monitoring over the entire fraction. So you could see that the patient is lying actually very stable during the whole radiation in this case. So lastly, I want to show you the DIBH workflow. I could not show you with the real patient here, but I would just demonstrate it using a phantom simulation that is actually very similar to the DIBH workflow. So we use also the CS dynamic lung phantom, and now the program is, the phantom is programmed to simulate actually a free breathing pattern, and then followed by DIBH, and then after that, the free breathing and so on. And this is actually what we get. Let me pause the video for a while, just explain you. So on the left side, this is the iPad that we use as a remote control. So it comes with the system. So this is the control the RTT can use in the treatment room to look at this information. In addition to the big monitor that we have as well, that could also change the setting and do some editing here. And then on the right-hand side, we have this iPhone that acts as the patient coaching device. So this is what the patient would see. So this is mounted in front of the patient during the irradiations. So we start the video again. You could see that during the free breathing, that's what the system is recording. So you will show you this free breathing pattern. You could see now we are still far away from DIBH workflow. We have still a large error here, but this is expected. And this is what the patient is seeing all the time. She's getting a feedback of her own breathing. But when you say she's ready, she'll just breathe into these windows. And then you could see that we are now in the DIBH phase, and then the values are all green here. We see that we are now, we could now start, for example, the irradiations. And then we could monitor this all the time. The patient will try to hold this position as long as possible. But once we see that, okay, she could not hold this position anymore, so we get directly a signal the patient is leaving this DIBH breath hold, and then we could stop the radiation, and then she would just start breathing normal again. And then after some time, so that then she could try to do that again. So this is how it works. So the patient gets a very simple feedback, what she needs to do. and we could see from outside or from our screen like monitor the whole process. So lastly, just want to quote what our RTTs said about Luna 3D during our clinical evaluation and implementation phase. And I really assure you, these are real quotes from our RTT. They told me this. I just translated this from German. So what they say, once you understand it, it is incredibly easy to use. And it works perfectly. We are avoiding some unnecessary cone beam CT repetitions now because we could correct these rotations very easily with Luna 3D. And I also heard that they said we can actually set up our patients with Luna 3D faster. And you could see in that video, if you know how to use the system, you have experience, it is really easy and fast. So I hope this presentation has been helpful for you in getting to know Luna 3D a bit more. And if you want to know more, I have this QR code here that leads you directly to the website of the Luna 3D. So thank you very much.